Hey, great Monday evening. It is a beautiful evening in the city of Brownsville, and it's been an awesome kind of day, despite it being a manic Monday. And manic Mondays could manic Mondays or manic Mondays, but so far so good. And tonight we have a special guest with us today, so we're going to cut the pleasantry short. We do have Dr. Teresa Saavedra with us today. Doctor, thank you so much for being with us today.
Hi, good evening. How's everybody doing tonight?
Good. And thank you so much for your time. And of course, we got Frankie Oliva with us. Hey, Frankie.
Hi,
Good
Frank.
evening, doctor. Hello, Erasmo. Good evening, world. How's it going? It's been a hectic 24 hours. Got a lot of awesome responses lately. My phone was blowing up. I didn't sleep till 4 in the morning last night. Woke up to some good news, positive news. We will always have detractors in our life, guys. But like anything, we got to keep trucking. I will not be deterred. The ultimate goal is to serve my community for BISD Place 2. I will not bend. I will not fold. That is what I'm in for, and I'm not gonna deter from my goals, guys. Thank you so much, doctor, for your time. Thank you for being here with us and answering the community's questions. I'm eager to get this show started, guys. Thank you so much.
Thank you. And one of the things that did come in today, we did get the numbers for Cameron County. We have 321 known positives for Cameron County. 179 of those are ours. Here in the city of Brownsville, we do have 179 individuals that have tested positive. Of those 179, I would dare to say 25, 26 of them are our students. Again, going back into the 20-year-olds and the 30-year-olds, we've got 30. And again, it's just blown up. I mean, Brownsville has become the hotspot of Cameron County. Dr. Saavedra, you've seen the increase in numbers, not only here in the city of Brownsville, but statewide as well. What do the numbers tell us, Dr. Saavedra?
I think what the numbers tell us is that we're missing something. We're missing something really important. The three things that I see currently in practice right now is that we're not doing one of three things. We're either not washing our hands, we're not wearing our masks, or we are not socially distancing. And socially distancing is now questionable. Before it would have been 6 feet, and now there's come into question that now it should be perhaps even more than 6 feet. I mean, some people have thrown out that the numbers could even be as high as 30 feet. Which is pretty intense. I've seen some of the coughs and sneezes when the scientists are doing their experiments going all the way to 12 feet, which is double the distance of where we should be. So we have to really put into question, what are we doing wrong? What could we be doing better? Are we a community that is uniting separately, but uniting together and trying to figure out how we can keep our children safe, our elderly safe, ourselves safe? What could we be doing better?
Well, what are I guess the biggest concerns in regards to, and something we spoke a little bit about is I tend to fear that our numbers are being underreported a little bit. Is there anything in regards to underreporting the numbers that would be like a pro? And again, the same question: underreporting the numbers, does it have its cons?
The underreporting, I'm sure, is happening. I think what happens is in real time, there are going to be delays of people getting certain certifications, death certificates to, or cases, not just death, but cases of positives to the county. And because of that, there's going to be some underreporting for that particular day. So as it rolls in, the delays are there. They're real. I mean, right now, it's taking upwards of a week or more to get exactly more than a week sometimes to get a positive or negative test. So I'm having to warn my patients as they are testing that they may be out of work for a week or longer, and that I set up that expectation. And I just say, sorry, right now our labs are what's holding us back. We are here to test. We're happy to test you, but we have to wait because the labs are our limiting factor right now. So, for those that don't want to wait that long, we just have to figure out another way to stay a little bit safer.
One of the things that you just mentioned in regards to tests, Saavedra, a lot of the concerns about there are the efficacy of the tests out there. Individuals have questions in regards to the sputum, the PCR, and other tests that are being offered out there. What is your recommendation in regards to what is the best test out there and what tests to possibly avoid?
Right now, I think the king is still the PCR testing. I think the efficacy of that one is about 97%. A close second is going to be your rapid antigen testing. That's a 95%. And then sputum, I haven't read too much about that one. The two top ones are the rapid antigen and the PCR testing. Really, the antibody testing had some traction somewhere in the beginning, but it kind of fell out of mainstream once we knew that, if we test for PCR, are we still going to have immunity? Are we still going to have anything at all? Does that have any traction at all? And actually had to talk to a patient today about perhaps needing to test a second time, and the fact that just because she tested positive in April, that she could absolutely be positive again, because from what I understand, it maybe gives you about 3 to 6 months worth of immunity. So just because you became positive once, it doesn't give you a get out of jail free card. You definitely have to still watch yourself, watch your family, and make sure that you're doing all of the precautionary measures.
Could you explain, doctor, very quickly, what does recovered actually mean? We've been getting a lot of questions in regards to that term, recovered.
Mm-hmm. Well, and that's a great question, because sometimes recovered is different for different people. Remember that there are people that get the disease differently. And when you get sick, that disease can manifest in you're asymptomatic. You could be mildly symptomatic, or you could be full blown and extremely sick. So when you talk recovery, it's also depending on how severe the disease was from the beginning. So those people hospitalized, perhaps they are recovering, but they may not be fully recovered for 3 to 6 months, because there is a post-viral syndrome that's occurring in these patients. I was reading about myalgic encephalopathy. That's a scary term, or chronic fatigue syndrome, and that becoming a possibility for people post-virus. So that's a pretty heavy term to throw around. Others may bounce back really quickly, and those are the ones we assume that are immune robust, that have a very strong immune system. And then there's those that in between that maybe linger and still feel that fatigue a little bit for maybe, onwards of maybe 4 to 6 weeks. But recovery is really a relative term, to be honest with you.
Dr. Saavedra, one of the other concerns that individuals shared with us this morning, and wanted you possibly touch on, was the concern for individuals that are expecting a child with COVID-19 positives, or those that could be at risk of becoming COVID-19 positives. What do we know about individuals that are about to give birth?
Great question, Erasmo. I actually just read a study, and this was an N of 2. So this was 2 patients, but it was based out of Italy. And they looked at 2 patients that were in their 3rd trimester that were coronavirus positive females. And they did give what we call vertical transmission, or transmitting from mother to baby to their children. Gratefully, both of those children survived the coronavirus and were able to move on. And, one had a very mild symptom. The other one took a little bit of time, but still mounted an immune response and was able to fight the disease and wear it off. But it is transmissible to our pregnant female patients. So pregnant females, I believe now, are, from the CDC, are actually at a heightened immune compromise, where they need to be more careful, like the diabetics and the hypertensives and your people that are overweight and obese. So we just have to be cautious.
Good. 2 questions. How can labs be so sure the result is COVID-19 and is respiratory or blood pathogen?
So it's in the respiratory droplets. and the labs can test through the nasal swab, the nasopharyngeal swab. It's also in the blood, as we can tell through getting the antibody testing. I still believe that if you look on any type of laboratory work, that there is a disclaimer that says this is not used to diagnose. So the CDC, the FDA, they're still not willing to, put a rubber stamp on it and say, yes, this is absolutely 1000% the way to test, but we still use it to diagnose and treat. But I think legally speaking that they're trying to put that disclaimer on there. So in medicine, there's never 100%. We're never going to have 100% test. We always have to go on clinical suspicion and make sure that we are absolutely, not just looking at a test, but also looking at the symptomatology and clinical picture of it all.
Dr. Saavedra, we're living here in Brownsville. We're living what we saw a couple of weeks or month ago in New York City. One of the things that we've been able to follow, that I follow constantly, is the trends. And we see how it's gone from Italy to Spain, New York City, complete blowout. And we're seeing a lot of the same things here in the city of Brownsville. We're seeing our hospitals are overrun. We see emergency rooms where patients are waiting, with IVs stuck in them in the emergency rooms, people having to wait outside. Are we becoming a hotspot, or are we already a hotspot? And should we expect more of New York City and Brownsville, Texas?
I'm not a pessimist. I'm really an optimistic person. But in this situation, I think we should be very conservative and assume that we may be headed towards New York. If we assume we are New York already, and we try to respond as how do we get away from becoming more of that, then I think that we will really help ourselves and our community try to retract and get those numbers to get down. I did see that in at least the state of Texas, I think from yesterday today, it went from 10,410 to 10,405, which was the first drop of, for in 2 weeks. So there was that glimmer of hope for 5 less patients of getting infections. But
I'll answer this.
Yes, go ahead.
I'll answer this real quick. ¿Algún plan para las maestras embarazadas? Al momento, en cuanto al distrito escolar, in regards to the school district, I don't think we have a plan set in place. That is something, and that is why it was shared to us this morning in regards to teachers that may be pregnant. I'm going to say that speak to the human resources and to your doctor to see if you need to be taken out of that situation where you're going to be coming into contact with students. Am I correct, Dr. Saavedra?
Absolutely. If you're ever in question if for your health condition that you should or shouldn't be at work because you feel that your risk of exposure is high, then please do discuss it with your physician. Please do discuss it with your provider, because there are definitely options. There is FMLA, which is your Family Medical Leave Act. You can have up to 3 months of family medical leave, and by law they still have to keep you as an employee, so that's a federally mandated law that you have access to in general, and then there's a myriad of other things that we can do to just say, hey, that person's not well, they feel a little bit sick, and one way or another to give time for the patient to be able to make their medical decisions as they need to, because I know sometimes this stuff comes and it's just one thing after another. So we all just sometimes need to take a deep breath and, relax and try to realize we're all on the same team and try to get through it day by day.
Going back, Doctor, to what was mentioned previously in regards to us possibly being, like New York, we recently heard of, over 170 doctors write a letter to the governor in regards to possibly having a shelter in place. Is that something that you would recommend at this time, or is this something that we could avoid by encouraging others to, practice social distancing and wearing a mask?
I do believe that it could be avoidable if we were a little more strict with ourselves as a community. I do see that there are families out when I'm socially distancing and trying to wear my mask, and I have to run in and run out. I spend the least amount of time in a store I need to, and spend more time at home with my family than I ever used to. just because of the fact that, there's nothing more to do. But I know that there are some families that are still not thinking that the coronavirus is real. I hear that almost daily.
Oh my gosh.
Shocking. I mean, I really cringe when I hear that, because the reality is I wish that we were in a dream. I wish we could wake up from the dream, but unfortunately we can't. So we do have to be aware that this is here. It's real. We have to accept that this is our new normal for now. And Lord willing, we will get through it all together. But we have to be very encouraging and put ourselves together in this and wear the mask. And yes, it's uncomfortable. Yes, it's harder to breathe in. Yes, it's a little hot because it's summer in Texas. But
Yeah.
we do that, then we'll get through this. And wash your hands, and don't take your kids to Walmart. Why are people taking kids to Walmart?
Keep
I
them
mean,
home.
exactly. It's not a family outing right now. I know.
No, it's not a field trip. Keep the kids at home.
Right.
Dr. Saavedra, one question. My daughter tested negative, but she has been like 2 weeks without the sense of taste. She has been quarantined for a month. Will her sense of taste eventually come back?
It should. Most people do have a return of the sense of taste. I'm not sure how long that takes. Usually within a week of most of my patients that I've seen that have lost a sense of taste, and it is fairly specific to coronavirus. Let me tell you, we are not seeing usually the amount of loss of sense of taste and smell and usual colds and flus as we are with coronavirus. That is fairly almost specific to coronavirus. It was rarely happening before, and it is pretty blatant now that if you have that, you pretty much have to go and get tested for coronavirus to rule it out. I have seen one patient that had a loss of sense of taste but did not have coronavirus. But every other patient I have ever heard with that has ended up being positive for it.
Thank you, doctor. Here's a question. Say you are sick and you get nose swab tested. You wait over a week for the results, but by then you had to go to the ER for pneumonia treatment and take meds for 7 days with no test results yet. Symptoms almost gone and still no test results back yet. What good are the results if you can't get them right away? Because by the time you get the results, and if you're negative, you could be exposed, and positive by the time test comes back. What's the point if you had to wait?
It's a good question, but that on the clinical side, on outpatient side, we're taking upwards of about a week or so. Sometimes, unfortunately, a little bit more because of the demand for the testing. But once you hit the ER, they have the rapid testing, and that usually comes out within the same day because at the level, the CLIA level, mid and high level testing, they get the test out a lot more efficiently and within the hospital. So those should be done either at the same day, and some hospitals may already have rapid testing available for their patients, or at most maybe one day. So every time I have a patient coming from the hospital, they have been tested for COVID, and that has already come back.
Now,
so that's not an issue.
And let me say this, guys. And I've seen the meme out there where it says, you get tested on Monday, and then Tuesday you come into contact, and then by Wednesday, Thursday, and then on Thursday the test comes back negative, but you've already been in contact. Look, guys, it's very simple. If you've got the symptoms, if you think that you've got the Rona, stay home. Separate yourselves from everybody else. And if you've already gotten tested, you shouldn't be going out to Walmart. You shouldn't be going out to HEB. You shouldn't be out there socializing with anyone except via Zoom or via online. Stay your butts at home.
Right.
Lock yourselves up, for goodness gracious, and don't come into contact with everyone and their mother. It's that simple. Anyone that thinks that they have the symptoms, separate yourself away from everyone until you can get a test. And then after you get a test, then still wait for the results. I don't care if it takes 10 days. Wait for the damn results.
Very true. I have seen patients that will tell them to stay home, to not, go out, not, to isolate, to not use the same cups, forks, knives, not even the same bathroom. And they will turn around and they'll have gone to get their own medicines that we prescribed them at the pharmacy and unfortunately infect our pharmacists. So that's I actually have had to talk to the pharmacists themselves about it and say, look, we are trying as physicians and providers to let our patients know. And I hope you know that, you know, we have some that are just not heeding the call. So,
Sometimes, what is your prognosis for Brownsville in the upcoming weeks, realistically?
well, if Brownsville continues to do as it's done, it will unfortunately get worse. Hopefully, it won't, and we'll look at the numbers and we'll say that's too much, and we will. Hey, Dr. De La Yada, I miss my colleague. So yes, but hopefully we'll get back to having that very, very low level of positives and really keep it at a minimum. But if we don't make a change, because the only way this virus gets out is if we continue to not listen to what the experts say. If we continue to do our own thing and the doctor Google or listen to someone who's not an expert in it, then unfortunately we are going to end up getting infected and infecting one another again. So hopefully we won't do that. Hopefully we'll be better at it little by little. We'll figure out what we're doing wrong.
What is the age bracket, or what are you seeing more? Is it more the elderly, more young teens, or young adults being treated by you?
Actually, I see a myriad. I see, and I do work on PD side, but I don't, there are pediatricians in the clinic I currently work in. So I get to see usually 18 and up. But what I am seeing the trend of, and this is fairly sad, is that our young adults, unfortunately, our teens and our 20-somethings, they are not listening at all. They are going to parties. They are going to, the island, doing, of course, some of them have just barely graduated. And, for class of 2020, yes, I think you got robbed because you weren't able to share your full graduation. But unfortunately, there's nothing that can be done at the moment. But it's the teen and 20-somethings right now that we need to educate the most, because I'm seeing that they actually are the ones that start off the infection in the homes, and then they spread it to mom and dad and abuela and abuelo and tío and tía. So it just gets to everybody, and then little brother and little sister. And so it's going in little, family pods, unfortunately.
Oh, Doctor, I'm going to ask you the $1 million question tonight. It's the question that a lot of people are waiting for us to ask. And, one of the things that we've been struggling with is with our school district. Our school district is adamant to have our students return back onto campus. We have seen that several other districts have had adhered to the recommendations of the doctors, especially the local doctors, and have said, no way, hell no, we won't go. What is your recommendation in regards to students starting school 3 weeks from now?
Absolutely not. I would not. I mean, I have a 2-year-old and a 4-year-old. I won't even be sending them to Montessori. I wouldn't send my elementary school, middle school, nor high school child to there, because there's just too much variability right now. And it will take one bad maneuver, and then the infections can spread, and it'll be like a wildfire. Our children deserve more than that. Our children deserve the best from us, and the best from our board of trustees. They deserve us making a very or entrance into it, and it shouldn't be sloppily put together or halfway done. It should be something that's very well thought out, and with a lot of forethought, because we can't afford to have our future generations be taken before it's too soon. I mean, unfortunately there are children that are dying. I mean, it's not a zero.
Yeah.
It's very sad. Have children right now that are getting Kawasaki-like diseases. And if for you, those of you that don't know what a Kawasaki disease is, they get upwards of 105. That is scary as a parent. It's really scary. They get a red tongue. I mean, they're sick. No parent wants their child to have that kind of a temperature. And it's just scary to even think about, much less to actually live through. So even if it's one child in Brownsville, I don't even want one child to have that. So, needless to say, it could be more, because of the way that COVID, we believe, has a lot of circulatory implications to it right now. So,
we've heard from Educational Secretary Betsy DeVos, and she made mention in regards to it's a 0.02 individuals that are going to die in regards to, our students at the school districts. And I mean, someone made the math, and I'm not good at math, Dr. Saavedra, but they said it's like 15,000 children. And, and they say it como que si no fuera nada, like it's 15,000 children. I go like, are these people crazy? I mean, if one student dies in the whole damn country, it's one student too many. And all we have to do is stay away from each other. And the best way to stay away from each other in regards to our teachers, our students, and everybody else out there is to stay at home and learn as best as you can from home. And, a lot of teachers, a lot of parents have said, you know what, even if they lose the whole damn year, at least they don't lose their life. I don't think nobody wants to roll the dice on their children, for goodness sakes.
I don't. I've told the same to friends and family that have thought about whether they should be taking their children to the school district and restarting school or not. I'm like, I'm not ready to let my kids to leave and roll the dice. And I agree with you. 0.2% is still 0.2%. That's 100% of those 0.2%. That's too much. We can't do that to our children.
Is the virus more virulent as it was in the beginning? Is it the reason why the cases are rising?
I haven't checked it recently, but I know that the strain that came in New York was very virulent. The one that came from Spain and Italy was very virulent, and when it hopped over to New York, that was much more virulent as well. Versus the one that came from the other side of the country and into California, that quite as. But I'm not sure, because from what I understand, the metamorphosis of the coronavirus has been fairly slow. But the one morph that it did make was quite a large one, and the change of the shape that it made actually made it much more possible to be infective. So, gosh, even though it might be slow, it's still very lethal right now. So it's who knows what it'll do, but I don't know what currently is the virulence of it.
Doctor, and this is thinking hypothetically, but in your opinion as a medical professional, what are the possibilities, or if the school district is aiming towards having the students go back to school, what could it possibly lead to? What do you foresee happening in a month, 2-3 months from now?
The moment a child starts becoming sick, and a mom that thought twice about it, has their child be the one that's sick, there's going to be hell to pay. I mean, I don't think that there's going to be a person out there that isn't going to be angry about that one child dying. Needless to say, if it's more than one, I think that everyone is going to just one day stop. They're just not even going to send their kids to school. And whether the BISD likes it or not, the people just aren't going to show up to teach. So you either make an alternate plan because no one's there to teach physically, or there's just going to be no one to teach. So
100%. And one life is one life too many. And, one of the things that happened today, and we'll throw a little bit because a lot of individuals are making mention of it. Yeah, the only thing that we learned today at today's emergency school board meeting, and, it's very unfortunate because if you're going to have an emergency meeting out there, bring something to the damn table. The only thing that we learned from today's meeting was how to say baby shower in Spanish and how to say hotspot and how to say Wi-Fi in Spanish. And, one of the things that I think that's very, very frustrating, and I know it's very frustrating for medical personnel, Dr. Saavedra, because we've had Dr. Cerdán on here, and you could tell the frustration. Dr. Eder Hernandez, we have Dr. Jamil Mahdi on here, and they all say the same frustration. It is frustrating for individuals not to make a decision. Make a damn decision and let us know what direction we're going to. And we have received absolutely no direction from the school board. And and now they're asking for the mayor. Oh well, the mayor needs to shut the schools down. He did 3 months ago. He shut them down 3 months ago, and they were saying they were going to take him to court. They were saying they would go all the way to court in order to keep the damn schools open. It's a failed experiment. We opened up the schools. We put in 30 individuals in there. We've got positives. We started distributing food because everyone was like, give him food, give him food. And now we've got food nutritional services people dying and others that have tested positive. Goodness gracious. It's a failed experiment. We need more shelter in place. We need more stay away from each other. And that does not mean having hundreds of individuals, if not thousands of individuals on campus where they're going to have contact one with another. Goodness gracious, guys. And you know what, that's something that you mentioned is so very true. You know, I'm so frustrated with all the individuals that go out there and say it's a hoax. It's not true. It's like the flu and everything else. It's just so frustrating because we're seeing the people dying around us. You all are seeing the hospital beds incrementing. I mean, in regards to overflow and everything else, individuals in the ICU. I heard that one of our great friends, Joe Valdez, you know, he's in the ICU. We've asked for prayers for him regularly. But aside from the Rona, it seems like he's contracting other issues. Is that common in individuals where they start contracting something else besides the Rona?
I do see co-infections that happen. That's a great question. So we do co-test for flu and strep as well. And I do see some co-infections happen, but remember, this is weakening your immune system, and there's something that happens called a cytokine storm where you get a very giant amount of inflammation. So when that happens, it just overwhelms your system, and co-infections and opportunistic infections is what they're called. They just start occurring, and sometimes very rapidly. So yes, there are other infections that happen, and unfortunately, some people succumb not to necessarily the coronavirus specifically, but to the co-infections that come along with the coronavirus. So
I'm sorry. What's the doctor's opinion or when schools will normalize during the coming school year?
I'm sorry, say that again?
Yeah, what's the doctor's opinion if or when schools will normalize during this coming school year?
You know, gosh, that's anybody's guess right now. I mean, you know, I'd heard opinions about, you know, what they thought. I mean, Dr. Fauci, when he first said what was happening back in March, he said, okay, we got a couple of options. It's going to be, you know, we have a large surge now, and then it goes down through the summertime, and then we have a big surge again in the fall, and then it goes down. That was option one. Option two was that we have a slow burn, or there was another third option that had, you know, consistent all the way through. I'm thinking we're getting the last option because most people thought we probably would get a little reprieve from summertime and maybe coronavirus wouldn't be quite as prevalent in summertime. But we're in the midst of another outbreak and it's the middle of July. So we do indeed have quite a bit of an outbreak on our hands. So if Dr. Fauci was right, and remember, he is the authority, you know, being the head of the
Task force.
And the task force. So he basically is saying that, you know, we might be in for a long haul. So we need to understand how to be good at socially distancing and finding alternative ways to be with our family and friends. When they aren't, you know, breaking one of the rules of not wearing a mask, even within families, you know, one family to another, even smaller pods, one, you know, small family unit is tying up with grandma or grandpa, and then unfortunately infecting them too, or other family members that aren't directly in the house but are related households. So we do have to be careful. And even though we love our aunts and uncle, even though we love grandma and grandpa and want to go visit them, we need to love them enough to stay away.
Doctor, what would need to be done in order for you to confidently say it's safe to go back to our schools? Is there something that could be done by the school district for you to assure the public that it's okay for them to send their students back?
If you can put our children in a bubble, that we can have them walk around like little bubble children. I mean, honestly, it's so hard to actually, because I mean, depending on their age groups, some of them are better at following directions than others. But I mean, I cringe thinking about elementary children. I mean, they get infections just generally from being in daycare. So God forbid when, you know, they go to school, to the Montessori or to elementary school, I mean, they're going to touch each other and they're not able to follow those directions. Yeah. And I don't think that there is any type of thing that you, and I know that they're trying. I mean, a lot of the schools are saying, let's put masks on and let's shoes and have them not wear it. But even with them washing their hands, they still put their hands in their mouth when they're smaller. Now, as they get older, perhaps not as much, but they still maybe put their hands in their face or touch their eyes a little bit more unknowingly. So I don't think, unless in high school, maybe the most responsible of them all. But again, the high schoolers are the ones that are going to visit friends. So I still think that the fact is that when you hang out with your friends, you're going to want to visit with them. And if, your friend has coronavirus, you're going to get it too. So until the numbers themselves go down, I don't know that anything other than the social distancing and mask wearing is really going to be enough, because we still don't know enough about the disease.
And what that type of PPE do you suggest teachers have in their classrooms? I mean, there's been a lot of examples out there in regards to, what different countries have done. We've seen a lot of pictures and images in regards to what China is doing. I mean, is there anything that you think would be suitable for our, and again, one of the things that you mentioned, Dr. Saavedra, is that, a lot of it has to do with the culture. Our culture is very abrazadora, hugging, kissing.
Yes.
And children are probably like 10 times more to do it. I mean,
Yeah.
What PPE would you recommend for our teachers out there?
If it absolutely had to be done, I mean, we would probably need teachers with, definitely the masks. And at that point, I would at least say a cloth mask, potentially, a surgical mask, but the surgical mask that they get won't go to medical personnel. So that's always a hefty weigh in there. But maybe even face shields, because I mean, depending on if they have the little kids sneeze, little kids cough, and they don't have as much control of their bodily faculties. So depending on, because if it's a special eds teacher, they may have a student, unfortunately, that may have no ability to control those things and may need to have a much more aggressive amount of PPE than, say, someone that's in, a high school class where maybe they can go with a little less. But I would say at least some type of gloves, a gown, and some type of cover on their face, which means that they're going to pretty much look like another, healthcare personnel.
And I have a question coming. Are there any long-term post complications after a child has been exposed, like blood clots or respiratory complications?
I haven't read that as of yet. The Kawasaki-like disease does become a blood clotting issue. There are adults that are having like 30s and 40s that are getting strokes that were formerly healthy. So I do believe there are implications for blood clotting with coronavirus. And even like months afterward, I'm reading about cases of where, you could have recovered from coronavirus as an adult, and you can say, gosh, I have a pain in my leg, and they check it out and you had a late coagulation of a blood clot that happened. But as far as children are concerned, I don't believe there are post-infection blood clots that are happening specifically in children. Most of the cases I've read have been in adults, thankfully, because Lord knows that I don't want to really have to read that many cases as a parent. It's very sad to read just one. Yeah, I haven't read many from the pediatric perspective. It's been more cases of adults.
Doctor, in regards to schools, what would be your recommendation to the district in regards to nurses? Is there going to have to be an increase in nurses, or what? What would the nurses right now what should they expect in going into the new year?
The school nurses absolutely should increase. I mean, because you need a better ratio. I mean, you're putting, how many students at one school with potentially just one school nurse. And in a normal circumstance, that nurse is just dealing with coughs and colds and just little things here and there that are very easily treatable. And you send them back to mom and dad, or send them home for the day, and then they go back to school the next day. This is not that kind of bug. It will not go away in a day or two. Like, you're going to get the full on body aches. You're going to get, potential diarrhea and nausea. Some people, end up needing, quite a bit of respiratory support. So, and when they get really bad, so no, it's not going to be just one nurse. We need a couple nurses, and I would think that the ratio needs to be pretty big, because you're just exposing that potential nurse to quite a few potential exposures daily. So I mean, that's a pretty dangerous job for one nurse to have, because I don't even know what the typical school size is right now in Brownsville.
It's horrible. What is happening to our lungs when we have COVID, Doctor?
So what happens to the lungs usually is that the lungs can get filled with fluid. It's called pulmonary edema. Also, the lung lining can get inflamed, and that inflammation, that cytokine storm that happens, that can not just happen in the lungs, but in many places in the body, that inflammatory response actually short circuits our immune system, and it just kind of pulls it down. So our defense mechanism is temporarily shut off, and that's where coronavirus becomes lethal. So often it happens where you'll get COVID-related pneumonia or COVID-related respiratory issues. Not always is it lethal. Thank God that many people just have a mild course of the disease, but there are some that, depending upon their comorbidities, will end up having quite a bit of difficulty with the coronavirus.
Doctor, one of the things that we've been concerned with is in regards to the refrigerated trailers that are starting to appear, not only in Harlingen, but also we have one ordered for the city of Brownsville. A lot of individuals want to dismiss these as generators. Have you heard of these refrigerated trucks coming to our area?
I knew that they were coming to Hidalgo County. I think I'd read about them coming to Corpus Christi as well. I knew it was a matter of time before it was going to come down this way, because we are getting the uptick in cases. I'm not really surprised about that. I wish it were a surprise, but unfortunately it's not. I mean, it's just the sad logistics of what's happening right now in our community. So we just have to be careful and make sure that we do everything we can not to fill up that truck.
I think what Lorenzo says is very, very true. Doctor says that we are in it for the long haul. Guys, I mean, there's no doubt that we are in it for the long haul. One of the things that, we have been warned by CDC officials, by the White House task force, doctors, not the president, the task force, doctors and scientists have been that if we do not do social distancing, if we do not protect ourselves and our families, if we continue to social gather, we continue to go to these events, we continue not to wear masks, they warned us that this would happen. No one should be surprised in any way, shape, or form. There's no way that the city of Brownsville is out of this. Not today, not tomorrow, and not in the next 3-4 weeks. It's impossible. And 3-4 weeks is the time frame that the school district has given for them to ultimately decide if our teachers are going to go back onto campus. And I'm going to stand by my stance. No one should be going back on campus. If we continue to use that train of thought in regards to sending individuals onto campus, our community is going to get from red to mega red, super red, very, very, very quickly. We're already a hotspot. I mean, I don't know if we would consider ourselves an epicenter in regards to the per capita, but I would say, Dr. Saavedra, that we're pretty close.
Yes, we're at a dangerous level. We're at a severe 4 right now. We're this close to getting a level 5, and that level 5 means that we usually close the state down. I actually looked today on the news to see if Governor Abbott had made a decision yet on whether he was going to do it. I was a little shocked that he didn't do it, because the levels are getting up, but I know he's trying to be sensitive to the people that need to eat and make a living. And it's a hard balance to make, because I understand, we all have to eat and make money to eat. But at the same time, we all have a way to come together to try to help one another out, especially in these special circumstances. And if need be, we just come together as a community to help each other out, and then, worry about the specifics later, but just help each other out, give each other food, clothes, whatever we need, so that we can get beyond this and not worry about the financials quite as much. I know the government is trying to help with the incentives that they've been doing for businesses and also for individuals. But I'm sure many individuals at this point are saying that it's not enough. And that's really the problem, is that economically, many people can't afford to not be working. But health-wise, we all should be affording to stay at home.
Saavedra, what would you say to people who say that we should reopen because everyone is going to get it anyway?
You know, I don't believe that. I think that the people that don't get it are the ones that are mindful about not getting it and really pay attention to the possibilities that they are washing their hands, that they are able to social distance, that they are, you know, if you do have that exposure to someone you believe has coronavirus, go home and take a shower from head to toe, wash your hair, everything. You know, assume that you've been contaminated and just wash. If you have to take 2 or 3 showers a day, do it. Because hand washing goes a very, very, very long way.
Let me tell you this, you know, and I suffered from a little bit of diarrhea this weekend. And, you know, I went on there and I did do a little bit of research in regards to, you know, and diarrhea is a symptom, you know, of coronavirus.
Yes,
But,
it
you
is.
know, one of the things that, you know, and they asked me this morning in the morning show, they said, Erasmo, do you have corona? And I said, absolutely not. And the reason that I know that I don't have corona is because I'm always by myself. I maintain social distancing. I wash my hands. I have all this thing that people misconstrue as lube all over me, all over the time. So I am always very, very well prepared.
Good
Guys,
job.
and going back to the same question, guys, you don't have to get Rona. You
No.
choose to put yourself in situations where you're going to get Rona. So going to the island in big old bunches without face coverings and without maintaining social distance is a mistake. Going to Walmart and HEB with your 5, 6 kids who are not wearing face coverings and grabbing every single thing and throwing themselves on the floor is a mistake. So do not be surprised if tomorrow all of a sudden 3 of your kids turn out positive and you go like, I wonder how that happened. It happens because you're out there.
Whenever I do the little bit of contact tracing that I do, and I don't do extensive, but I ask them where they believe they may have gotten coronavirus from, then I will hear, you know, I went to the island, or I was exposed potentially at work, or there was somebody that was already positive, and I ended up finding that because I was around them, I was a positive, potentially positive as well. And often they're not wearing their mask. They think that it's good enough that you're like, I know that person, they're okay. But coronavirus is invisible, and we don't know if they're okay. We have to assume, just, you know, and I hate to put it like this, but we have to assume, just like HIV, we have to assume everyone's infected, and we just blanket statement that we stay away from them and do our universal precautions is what happens with HIV, and doing your gloving, you know, to get blood. But this one, because it's airborne and because we don't have that blood contact, you don't see the red. It's actually even more dangerous than HIV in that way, because of the fact that it's just so simple to get it. So we do have to be even more vigilant with coronavirus than even HIV, believe it or not.
Doctor, you had previously mentioned that we, according to the Matrix, that the city of Brownsville released, we are in a category 4. What would it take for us to get bumped up to a 5? Are we on the brink of that?
Oh, yes. I believe that any second now that we could be put in a category 5 situation, because our hospitals are pretty much full. We're towards the brink. I mean, they probably waver up and down just a little bit here and there. But I think if we don't heed the call, that absolutely, you know, a little bump further and we're going to be up again, where our numbers are going to be even further, which means the governor, for the safety of the whole, is going to tell us to just shut down completely for another, God knows how long. Hopefully it's not another, because it felt like forever, but what was it, like a month and a half, 2 months, but it felt like it was eons. You know, I just felt like I was at home forever. So, and I went to work and came back, so I can't even imagine the people that just literally stayed home looking at their 4 walls. So it's not easy to do. So, you know, better to just be cautious and, you know, keep ourselves busy with, you know, getting masks. If you don't have a mask, get one. If you do have one, make sure to wash it if you're using a cloth mask. And Think about it twice when you're going into the store. If you see a crowd of people, maybe turn the other direction instead. Because I know, people just want to go with the flow and they say, oh, well, I'm already here. I might as well just go in and do it and get done. But maybe you don't go to Walmart if it looks too crowded that day.
Amen.
Maybe another day.
One of the questions that's being asked by Elizabeth and by others as well is in regards to treatment. And if I understand correctly, each individual is treated differently depending on the severity of their COVID. Can you give a generalization in regards to the process in regards to treatment and what treatments are best recommended or best practice for us?
Absolutely. So for the very mild cases, I just treat them symptomatically a little bit, and I will, treat that cough and give them a cough medication. If they don't like cough medications, I'll tell them at least take a spoonful of honey that's got antibacterial properties in it. Vitamin C and vitamin D go a very long way. About 1,000 milligrams of vitamin C 3 times a day. Vitamin D, I would say in about a 5,000 will be really good to boost the immune system. And then colorful fruits and vegetables to just continue to use that, because that's going to bump up the immune system. Now, if they start having more symptoms where they're congested, maybe they're getting severe headaches, I'll add on a little ibuprofen, especially the 800. And then also I will, but depending on how severe the headaches are, I may treat them for a potential for a sinus infection. I don't always throw the azithromycin out there because, remember, we only have so much of a Z-Pack. So, sometimes I'll give them an Augmentin, sometimes I'll give a Z-Pack or an alternative depending on if they have allergies for it. But then the more moderate, the asthmatics, I'll add on an inhaler, or I will give them prednisone if need be. And if they think that they're headed towards a severe case, lately I've been giving ivermectin, because that has seemed to be what really helps stop the disease. So, that we have to make sure that we're using very judiciously. We can't just, throw it out there and give a whole bunch of stuff. And I know Facebook has been telling us that ibuprofen and prednisone is bad. I am here to tell you that is a lie. There is no studies that have founded that right now. Although for whatever reason, and I don't know if this is just people just trying to be ill-natured and trying to spread lies, but there has been no truth to that. Absolutely, I'm still using ibuprofen. I'm absolutely still using prednisone, especially in my asthmatics. But I do warn them against nebulizers, because again, if you go get your nebulizer and you're using it for yourself, please don't, if you think you have coronavirus, please don't use that nebulizer in front of the entire family. You're just going to spew it out there. And please don't borrow your neighbor's nebulizer, because I have heard stories that I borrowed my neighbor's nebulizer, and then you could be not only getting the infection, because who knows if they're using their mask or their own mask, but then, if they don't know how to use it correctly, again, you're going to be potentially spreading it over, because once you hit that point of nebulizing, you can actually spew at quite a few more feet, like 12 feet. So
can you elaborate on the cytokine storm in the body?
So the cytokine storm is basically a bunch of immune factors. That's an inflammatory process, more or less, and it's a very intricate process that basically short circuits the immune system, and it triggers that inflammation response, but it's an abnormal inflammation response. It's not a kind one. It's an abnormally robust immune response. And that abnormally robust immune response actually makes the person's body weaker, and it makes the fighting of the virus even harder than it should be, because it's such an abnormal and overwhelming response to the body. So we have to try to fight that. I hear dexamethasone is one of the smoking guns in the hospital area that's helping to save the day. I know that we're using a little bit of it outpatient, but especially in the hospital, the ones that receive dexamethasone are doing much better than the ones that don't receive it.
What are the differences between a mild case of COVID-19 and a mild case of the flu?
A mild case of COVID-19 is like worse than the worst day of the influenza. Way, way worse. I've heard people describe it as much worse than the flu, because most people say, oh, isn't it like the flu? No, it's worse than any flu that you've ever experienced. And I hear the headaches are also very severe. The body aches are really severe. Those are what I hear is the most severe. Some people are disturbed by the loss of sense of taste and smell. The diarrhea is annoying, but what's worse is the body aches, the severe fatigue, and the headaches. Those are the ones that like really just, I heard one young gentleman describe it as like he couldn't even get out of the bed to eat, go to the bathroom, anything. He could do nothing. He just laid there for a day because he didn't have the strength in him to get up to do anything. So you are extremely knocked down.
Doctor, is this something that within time, each and every one of us is going to get this virus, in your opinion?
I don't think so. I think that as long as we stay vigilant, if we are smart about our maneuvers, that we won't be a part of the people that get it. And I'm not trying to be divisive and say that, we're going to be the people that get it versus the people that don't. But I do want us to have a majority that don't get it. And I think that that's completely possible. We just have to be adherent to the guidelines and to the rules, and we can completely avoid this havoc in our lives and in the lives of our families. We just have to be more thoughtful and try to look for possible potential dangers that are out there, kind of have a little more forethought in it. But we can. I think that we absolutely can. I don't think we're all going to just be infected at one point. That's kind of what's the word for it? Apocalyptic theory, if you will. I don't think that's, I keep thinking back to Walking Dead a lot right now. I don't know if you guys watch Walking Dead, but I did. And, yes, there is a potential for infection, but not all of us get that kind of sick, and thank God for that. But could we? Yes. If we decide to not follow the rules, we could. But we don't have to. We could do what we're asked of, and I think that we'll all, for the most part, be able to stay safe.
Dr. Saavedra, my allergies kick in so bad in the fall. Complication to my allergies is asthmatic bronchitis. How will I know the difference? I'm concerned and scared at the same time.
So allergies are, and this is a very good question because the Sahara winds are popping up right now, and everyone is asking this question. I get a lot of this question right now. I just got this question right before I came on. A close friend who's also a physician as well, because it is very difficult. But asthma and allergies are different than the coronavirus in the fact that, number one, asthma and allergies, you don't lose your sense of taste and smell. Okay, so if you do that, please go get coronavirus tested. You should, and just rule that part out. But also with asthma and allergies, and specifically to allergies, you get itchy, watery eyes with allergies. That's very specific to allergies. And also you get a dripping at the back of your throat with allergies as well. That's called postnasal drip. And so if you have those two signs, you more than likely do not have coronavirus. Now, could you have coronavirus and have allergies? Yes, you could. So I can't say it's 100%, but I would rather treat you first for allergies and see if you improve with, your Zyrtec and your Flonase than to, start saying, oh, yes, you have coronavirus. Now, of course, all the employers are still going to want you to stay at home and make sure that you are getting better before they have you return to work. But I have cleared people that have shown positive for allergy symptoms, but have improved because they didn't need to be tested for COVID. They did very well and they were fine.
That's
yes.
one of the things that, I go to breakfast with Papa, and Papa is very necio. He's very necio. Papa still seems to think that because he saw videos somewhere on social media that it's just blood clots, and that taking an aspirin is going to prevent him from getting a coronavirus. Is that true, or is Papa nuts?
You know what? I think Papa might be a little bit smart. There are right to it being a circulatory disorder, because why is coronavirus been so all encompassing. I mean, it goes from head to toe on the symptoms. I mean, we have people heard of COVID toes? I mean, there's COVID toes. That's the rashes on the feet, but that happen because they're micro thumb, right? Or little tiny clots that happen. And they can happen like 6 weeks after you get your issue. And some people are asymptomatic, and then they look down one day and they say, hey, why do I have these little red spots on my toes? Those are COVID toes. You may have had coronavirus 6 weeks prior, and you go to your dermatologist and they say, yep, you had it before, and they didn't even know. So there's stuff from the feet and then the skin all the way up. You get the GI symptoms, the respiratory symptoms, there's the neurological symptoms. So I call it the chameleon. Coronavirus can be a bunch of everything, but when you talk about it being a circulatory disorder, the circulatory system is your arteries, your veins, and your capillaries. So that's everywhere. So to me, that makes sense. And maybe Papa's super smart, because if it is a circulatory disorder and it's causing turbidity and turbulence and you're getting clots, maybe a little baby aspirin could go a long way. Now, I don't have the data to share that, so I'm not going to say that Dr. Fossey or anybody from the CDC has said that, but I do think that that could potentially be beneficial. And I would say you'd probably want the one that's sensitive for the stomach. For those that have sensitive tummies, that's called enteric coated. You probably want to get one of those from the baby aspirin from the store if you're going to try that. Do expect that you might get a little bruising from that if you do, but it depends on the person. So do be careful. Some people actually have an allergy to aspirin. So I don't think it's a blanket statement, but yeah, you could possibly get some benefit from that. Papa could be pretty smart.
Papa is going to be very, very happy to hear that. And I'm sure we'll share it with him. I'm sure he's watching right about now and probably jumping up for joy. Better not be jumping too much.
Papa, smart guy.
Yeah.
He's a very smart man.
He is a very smart man. I'd love to tell you that. In regards to Marisa's question, I was reading it and I was going like, well, maybe it doesn't make too much sense, but maybe it does. If you have a family cluster, a whole family together that are in a house, all of them have tested positive, should they still be wearing their masks amongst each other since they're all positive already? Are there different levels? What is your recommendation?
You know what? I know that you're saying, one is infected, everybody's infected. What's the big deal? We're all infected, so we might as well but we don't know how much the virus spreading and shedding can make us more infected and give us more symptoms. I would say there's probably some truth to actually using your mask and trying to decrease the severity of your illness. So I would say it may be of worth to just go ahead and because maybe that person didn't have too much of symptoms, but you being close to them and talking to them for a conversation ended up giving them more of the virus shedding and caused them with more symptoms after you had that little chat. So I would say wearing a mask may be good. Now, I don't have anything that says, scientifically that absolutely should happen, but I would consider it highly.
Let me ask you in regards to some of the questions they're asking in regards to the process of retesting. We hear individuals that after so many days they get retested, and then after so many other days they get retested. What is the process, in short, or after you test positive for coronavirus? How many days? What happens? What happens next?
So CDC guidelines right now are that you have to be at least 10 days out from the last new symptom that you had. So 10 days out from that last symptom and at least 3 days without any fever-reducing medications. That would be aspirin, Aleve, Ibuprofen. So if you have at least 10 days since that last new symptom and at least 3 days since those fever-reducing pain medications, then you can potentially be released to work. Now, if you're a healthcare provider, they have special circumstances, so that's a whole different category. But for the general public, usually it's 10 days from the last new symptoms and 3 days from the last fever-reducing medicine.
I've been struggling. Sinuses and /marshal. Well, let me tell you one of the things that I do a lot of mocos, a lot of snot, and I do a lot of snot mostly because I have a small stomach, and I have a small stomach because I cut it in half. Individuals that have had surgeries of any form, any shape, are they more prone to get Rona?
Yeah, that's a great question. Yeah, I mean, are you alluding to for having a gastric surgery, a stomach surgery, like
Yes,
a like
I had the
gastric?
sleeve.
Ah, me too. All right, we're sleep buddies. Um, yeah, long time ago. When was yours?
Mine was October 31st, 2016.
Mine was it was way back November of 2009. Way
Wow.
Yeah, if you look all the way back on my Facebook page, you'll see. Yeah, I used to weigh 240 pounds. I come from a line of family of a lot of diabetics. So that's why I'm so passionate about helping our diabetics here. But as far to answer your question, I don't think, unless you had ulcerative colitis or some type of gastric issue or Crohn's disease, because those are both conditions that are autoimmune disorders. Just because you had a gastric sleeve or a gastric bypass, I don't believe that you should be at an increased disadvantage to get coronavirus per se. Yes, your stomach is smaller. For the sleeve, for anybody that doesn't know about the sleeve, it's the size of a banana. So it takes 2/3 of your stomach out. For the gastric bypass, it gives your stomach about the size of a thumb.
Yeah.
And then it across your intestines. So it's not just restrictive on the stomach like the sleeve is, but it's also malabsorptive. So you're not going to get the absorption the same way that you would normally. But overall, I don't believe it leaves you with immune compromised state. So I don't believe that's going to be an issue unless you have some great issue with malnutrition. Now, malnutrition, and that could be like a subset from people that do have a gastric sleeve. It's one of my passions is dealing with obesity, having to deal with that myself for so many years. I do plan on becoming a bariatric physician and getting boarded in that. So
Awesome.
basically, with that that malabsorption, you do get a lot of nutritional deficiencies. And for anybody out there that is not checking in with their bariatric, you should be at least getting yearly labs and pulling those, because right now nutritional deficiencies are a big deal. We need your immune system robust. If your immune system is not robust, it means you're going to be more likely to get the disease. And that's where it's not directly from the surgery by the fact that you get the smaller stomach. It's more from the potential that you're not following up regularly with your healthcare provider and making sure your labs are regularly drawn.
So you suggest, and this is just my question, not anybody else's. So you suggest, because it's very hard. We are on a vitamin regimen, so you suggest continuing with your vitamin regimen.
Oh, absolutely. Multivitamins, for those that hate fruits and vegetables, at least get a licuado, put some chia, put some linaza in there and stir it on up, have it for breakfast. So at least you get your 5 fruits and vegetables out for the day, because that's going to decrease the risk of cancer, increase your robust immune system. And then you're going to end up feeling a lot better and a lot healthier. But I do think that you have to be you just have to be smart and make sure that you're having a lot of good vitamins. One of my favorites, magnesium. I love magnesium. 300 enzyme reactions in the body. Amazing. So.
Please explain very directly how a patient is handled when they need to be sent to the ICU. This way, people might rethink about what actually happens once you go into the ICU. And let me tell you, Sergio, I've seen pictures out there because they've been sending to me. And let me tell you, it does not look pretty at all, doctor.
So people that end up going into the ICU are the people that are the most severe of all. They are the people that are usually the respiratory failure patients. Those are the ones that get intubated. It's not number one, the anesthesiologist and the people that have to clear the airway, meaning they have to intubate. They can't intubate regularly. They're all in their little moon suits. They're PAPRs is what they're called. And they basically have to do it through a box. And so they have to really see your airway through a box, a clear box, to try to decrease the potential for capturing coronavirus. But you will be potentially, and more than likely, every person that's in the ICU is put on a ventilator. And usually is put on what's called pressors or very high dose blood pressure medicines, because they usually end up having lower blood pressures or too severely high blood pressures. So and those people also usually end up becoming septic. So we have the respiratory failure, the ARDS, the people with the fluffy lungs. If you look at their chest X-rays, or severe sepsis where their urine bags look like it's a bunch of pus. It's pretty scary. Yeah, and it's not something you really want to be a part of. And remember, everybody, we're talking about going to the hospital, and most people think, oh, I can visit grandma and grandpa. Not in coronavirus times. You have to stay outside of the hospital.
Yeah.
You can't go in with them. I do know that usually children right now, I think one parent may be allowed to go in with them right now, but I don't know all the criteria for children and parents right now for those that get sick that are children. But no one really wants to go into the hospital, at least from what I see, because they are scared. They don't want to die alone. They don't want to be saying hi through, FaceTime or Zoom or anything like that and saying goodbye to grandma and grandpa for the last time via a video. So it's worth it not to get to that point.
How late is it too late to test for antibodies to donate convalescent plasma?
I believe you have to have it, and that's a great question. Thank you for asking that, Stacy. So for the convalescent plasma, I believe you have to be at least 3 weeks symptom free, and then you're allowed to donate. I did just have a friend based out of Jacksonville. Hi to David Johnson. Sorry you had coronavirus, but based out of Jacksonville, Florida. He just donated plasma to help giving life again, despite the fact that he got something really cruddy. So if any of you do indeed get coronavirus, please consider donating. We do have people that are benefiting from the convalescent plasma. I don't have a resource for you, but I'm sure we can find one for sure to get you that information so that we can give back despite a bad situation.
Doctor, here being a border city, we see a lot of individuals cross over from Matamoros to donate plasma. Is there a risk of potentially them having the virus and donating plasma, in your opinion?
Well, usually when they donate plasma, they have had the virus. The convalescent plasma, that's the whole criteria, is they should have had coronavirus, and that what they're doing is they're giving antibodies. Okay. So basically, once you get that antigen in you, that's the foreign body. That antibody is the antidote that your body mounts up and it fights back. And so that's why they're asking people that have already previously been infected to come give the plasma so that they can actually give that antibody they mounted up to somebody that didn't have that antibody response mount up.
I'll answer this question. If teachers go on strike, can they lose their job? The answer is yes. Yes, 100%. Here in the state of Texas, a teacher will lose their job. I just wanted to answer that. Would it be waived because of the pandemic? One of the things that we have done is, we had State Representative Eddie Lucio with us on Saturday. I did speak with his office this morning, and they have submitted a request to the governor and to the TEA, Mike Morath, in regards to their want for there to be a waiver in regards to the 45-day mandate, the 45-day rule where individuals cannot opt to, resign. So that is on the table right now, and we should be getting information from State Representative Eddie Lucio hopefully sometime this week. I won't say today, but sometime this week. Can someone get the virus more than one time? We know that there's a doctor here in the Valley. I can't remember her name, but she had COVID-19 and then went negative and then got COVID-19 again. Why does that happen, doctor?
Because we don't have full immunity right now. Like I'd mentioned before, we don't know enough about it. So we don't know how long the immunity is, and what they've been saying somewhat, although I think it's still too early to tell, is that we might get 3 to 6 months worth of immunity if we've had coronavirus in the past. But that does not give us a get out of jail free card. We still absolutely can get it again. So just like the flu season and why we get flu one season and can still get it again the next season, coronavirus, similarly, you can get it one season and still get it next. But it sounds like the coronavirus may be even more frequent than once every flu season, because we do see people with the flu get flu A and flu B, or get the flu once and then go get it again, that have lower immune systems. But with coronavirus, I just had a patient today that I had to tell them similarly that they may have to get tested again, because despite the fact they had it in April, they may indeed have it again.
Oh. I'm currently fighting the virus with symptoms and came out positive since June 27th. My 65-year-old mother lives with me, and she only has a sore throat. They didn't want to test her, and I guess it's because of the lack of test. I don't Should I assume she has it?
I would really consider that your mother should go get tested because you are positive. Your mother, who's 65, and when you're in the 60 and above category, you're at the highest risk category as far as age groups are concerned. So that she should go get tested. Please tell her to go see a healthcare professional so they can evaluate whether that's needed or if that's something more related to another symptom from something completely different.
No. Let's see. My parents got tested exactly 10 days ago. I got a call 4 days after they tested, and they were both positive. They were sent Z-Packs, and they are taking them. Today, I get another call, and they tell me that the results are in, and they are both negative. I told the lady that they called me before, and she was like, I think they gave you the wrong results. Does that happen, doctor?
That's a very interesting question. And unfortunately, yes, it does happen. But let me tell you why. It's because we had got such a backlog in the beginning that everything happened in such a rush that we had an immense amount of testing in a very small amount of time. I know from the urgent care that Eric Hernandez is a part of, and shout out to him. They're doing an amazing job at the sports park with Valley Med Urgent Care. That we got bombarded, and our lab shut us down temporarily because they couldn't handle the volume any longer. They had to concentrate on the people in the hospital that were the most sick. So recently we did have that issue pop up, and there was someone that had been tested. But then that first original test, it took about a week and a half, I believe, to get. But by then, the person had, I believe, tested again after that. But that second test came back before the first test. So there was some confusion because that first test was positive and the second test was negative between the delay. So, if you can have from 1 week to the next, you can be positive on day one. Per se on when you get tested because you're symptomatic for 2 to 5 days, and then on the next 7 days afterward, which would be maybe 10 to 12 of your illness, you could test out negative potentially and have a negative test. But if you don't know the date of your test, yes, you could be confused about having a positive and a negative given to you on results. So please ask the date of your test because that information is specific and important.
Doctor, have you heard anything about the Rh negative people are less susceptible if your blood type also has something to do with it? And I've heard of A, O. Is there something to the blood type?
I've heard that too. I'm not sure if that's true or not. I haven't heard about the Rh factors, the rhesus factor. That's the positive or negative on your blood tests. The ABO groups, I hear that the O group tends to be more likely to be the group that would be less likely to get it. I don't know if there's any truth to the matter. I mean, it's kind of like the nutrition, and people saying to eat for your blood type too. I don't know if there's truth to that or not. Not sure.
Can you please tell me which specific vitamin boosts up your immune system, or any way you would recommend? I know you mentioned multivitamins. Do you suggest vitamin D, vitamin C, ginger, bulk tea?
Definitely vitamin D, 5,000 units. That typically is pretty good on a regular daily basis. I personally take that myself. You can take up to 10,000 IU safely. There is the Vitamin D Council. You can look that up on the internet. That does talk about and promote vitamin D and the beneficial effects. It's both a hormone and a vitamin. And then vitamin C, you want to take about 1,000 3 times a day. On that. You also have anti-inflammatory properties in a lot of your spices. Ginger, you mentioned ginger. We could talk turmeric, other spices of that nature. But there is an anti-inflammatory diet if people want to go the natural food route, which I know is very Mexicana to do. So definitely consider making your food your medicine. That's a really cool way to get your nutrition in and make sure you're doing it healthy and wise. And still take your multivitamins, yes. Try not to eat Whataburger, please. I
Come
know
on.
it's tasty. It tastes really good, but it's
hard.
the immune system.
How long do antibodies for COVID last in your body?
I think it might be the 3 to 6 months that allows you the immunity. that they're saying. But to be honest with you, I think that the verdict is still out. I don't think they know the whole story yet. So we may find out that we don't have even that amount of immunity like we think we do. That's why people, once they're symptom free for 3 weeks, are allowed to do the convalescent plasma. They rush while they still have the antibodies there, but they don't ask them to wait till 3 months out because they may not be there anymore. So.
Now, do we have to get tested again and make sure we come out negative before we give plasma? Or will they be able to tell us there where we donate plasma? It's been a month since I came out positive.
You know, I'm not sure about that. I would assume that they want you to be symptom free, but there is both symptomatic testing or symptomatic clearance and testing clearance. So you can test negative twice, or you can be symptom free for the 10 days or 3 days without the ibuprofen, the aspirin, or the Tylenol. So there are 2 ways to clear somebody testing wise and get them back to work. So probably similarly, they're able to figure out how to donate plasma as well.
Well, Doctor, I think we've reached, believe it or not, we went through probably a million questions. Doctor, is there anything else that we need to cover tonight, or anything that you recommend, any last words, or any words out there for la raza de Brownsville?
Ay, muchas oraciones de Dios primeramente. No se olvide, Dios es la primera en la vida. También recuerdo, habla con tu doctor, tu doctora, habla con la familia, y respecto todo están diciendo a los especialistas, por favor.
Frankie, last words.
Thank you so much, Doctor, for your time. Based on what we've heard from yourself, from Dr. Sardan, and from Dr. Mari, it does seem that that the worst is yet to come. We have 4th of July numbers that have still, are on the brink of popping up, so to speak. So Brownsville, Texas is at a stage 4 in our matrix, and according to the medical professionals, we are expecting a possible shutdown. Again, from the medical professionals, that's the recommendation. So it's a very, very scary situation. I think the people are now starting to realize that we are in the middle of a crisis. When this first started back in March, back in April, I think we had a more relaxed approach to it. It's unfortunate that we have people on the board back then who thought, it wasn't as serious. And now it's unfortunate how today, they don't anticipate having distant learning. They're encouraging students to go back to school back in August. So thank you so much, Doctor, for your time and for your input. It's important for our community to know the severity of what we're dealing with, and how, like you said, ma'am, this is our new norm, and we have to get used to this, at least for the time being. So thank you so much, ma'am.
Thank you guys for putting on. I think it's a wonderful way to get the word out to the community. Thank you for all the both of you do for the Brownsville area. I love Brownsville. I miss all of my patients back in Brownsville. I'm coming back soon. I'm going to be starting a new clinic come hopefully in the next month and a half. True Help Family Clinic. I'll do a quick shout out to that. So for all of you that are watching, because I've seen plenty of people's names popping up that look and seem familiar, I'll be coming back to the Brownsville area because Brownsville has my heart. I do live in Buena Vista, but Brownsville is where I started at and where I want to stay at. So I'll be back there soon.
Well, that's again, thank you so much for your time. Again, one of the things that we always mention in regards to our medical professionals out there is that, y'all's time is gold and golden. And, besides all the hard work, the double shifts, the triple shifts that a lot of you are taking, y'all do take time out, to come out and answer individuals' questions. And as you can see, a lot of individuals are very, very interested and very, very grateful for everything that you do, Dr. Saavedra. You're a blessing to many, and please consider coming back soon.
I love this venue. I love my patients, and I love to teach people more about their body and about their health. So if there is any way I can help somebody understand a little bit more than they did yesterday about how amazing their body is and how amazing God made it, I'm so happy to be a part of that solution.
Well, again, thanks so much, guys. We thank you so very much for being with us tonight. We are at about an hour, almost 30 minutes, and it went by.
There's a curfew.
Very, very fast. Well, like I said, there's a lot of things that we'd like to talk about in regards to the meeting today, but we'll talk about them tomorrow. We'll be on tomorrow morning at 9 a.m. in the morning. We will have Dr. Rita Hernandez. Dr. Rita Hernandez will be with us tomorrow morning at 9 a.m. and talk a little bit about economic development. Also talk about a lot of the CTE programs that they're offering, especially right now with this COVID-19 situation that we're living in, and a lot of the certifications that they offer there with Dr. Rita Hernandez. And Dr. Rita Hernandez is well versed in regards to BISD as well. So we'll have her on and ask her some BISD questions as well. So even if she didn't expect that, she'll be getting them tomorrow morning at 9 o'clock in the morning. Guys, please stay safe, maintain distance from each other. Please wear face coverings, please, please, please. And above all else, guys, please be good to each other. If you could help your neighbor out, if you could take some food for them, if you could go to the pharmacy for them where they don't have to go out, please, we are in this together. Go.
Yeah, check on them. Just
Yes,
check.
please.
Make
Check
sure
out-
you never know what will change from one moment to the next. So just check on them periodically. It's completely worth it. It'll go a long way.
Please, please do. We're in this together, and those aren't just politician words. They're sincere words from members of the community. Be good to each other, and please be good to me. Thank you again, Dr. Saavedra. Bye-bye.
Welcome.